My name is John. I live in Hawaii primarily.
I'm Gina, and John and I have been together for 30 years and married for 17.
I have ATTR wild type with cardiac involvement.
We like to do a lot of outdoor activities.
I'm a water rat, so I enjoy the ocean. We like to hike as well.
We walk Jelly, our dog, every day, twice a day. And she's our little baby now because we don't have our daughter or our son home anymore.
We're Ken and Mary. I have wild type ATTR, and it's not hereditary. We enjoy travel, and we enjoy spending time with our 10 grandchildren, all who live nearby. We also have 2 West Highland White Terriers, Tony and Cleo, who do not answer to their full names, Anthony and Cleopatra.
Yes, we've had them since they were very small. They're 10 years old now, but they've been great fun.
We turned 80 last year. Both of us were a day apart in birthdays. It's great to feel like an ordinary 80-year-old. Now that is somebody with arthritis, a bad back, and no computer skills. But other than that, it's okay to be 80.
Being an athlete, I always paid attention to my body. I noticed the symptoms in 2012. I just felt I was having a lot of arrhythmias, as I would define it. I was visiting family and I just collapsed face first. And I wound up in the hospital that night. So 2 days out of the hospital, I went and I had an ultrasound done. And that's when they noticed that my heart wall was twice as thick as a normal heart wall. And then after that, I just continued with more tests. They came back and said I had amyloidosis, but they weren't sure which type. When I asked the question about life expectancy with the cardiologist, he said it'd be 3 to 5 years. So that made it real clear what I was dealing with. And then the other comment was, we think we've caught you fairly young or new for the disease. So he goes, that would play in my favor.
Having a stroke put me in the hospital, and the doctors there ran half a dozen tests. The final test was a cardiac biopsy, and that's when it was decided it was ATTR amyloidosis. Cardiologists who've been guiding me through that test process said, I don't know how to treat it. We sought a second opinion, and that doctor was even harsher. He said, there is no treatment. Mary discovered a amyloidosis support group. The doctor there knew something about amyloidosis. I went up at a break and said, are you taking new patients? He said, yes, and I became one as soon as I could.
They were very good about bringing in people who knew something about amyloidosis, so we got some basic information on different types and background information about how this thing works.
What is Attruby? Attruby is a prescription medicine used to treat adults with a disease that affects the heart muscle called cardiomyopathy of wild type, or variant transthyretin-mediated amyloidosis, ATTR-CM, to reduce death and hospitalization related to heart problems. It is not known if Attruby is safe and effective in children. Possible side effects may include diarrhea and abdominal pain. For most people, these side effects were mild and went away, so they could continue taking Attruby.
Attruby is the name of the drug that I'm currently taking. For about 3 months of being on the medication, what I found was there were no changes, and that was a positive for me. There is something out there I am taking, and it's working. So I've been taking that for 7 years.
The clinical trial that I started with is now Attruby. Before I started taking Attruby, I couldn't walk up a flight of stairs without pausing halfway up. Today I walk Tony and Cleo for a mile or 2 almost every day. We don't walk fast, but that's their problem. It has made a difference.
Support group's important. You know, I'm glad I wasn't facing this alone, because I think that would be a lot tougher.
I think being as supportive as I can in any way, mentally, physically, then if there's anything I can do to help them on the medical end, I will do that too. Animal support is really helpful too. Yeah. I think having a pet is very helpful. Sometimes the caregiver can get a little bit, emotional too, because, I feel what he's feeling sometimes. Our pet, she can help lift us both up.
I'm very fortunate.
I like the brochures that I've seen where they now list the support groups, or there's 3 or 4 of them, and they now have a patient advocate maybe that you can call in or have them contact you. There's just so much more out there where you can reach out to someone.
Keep doing what you love to do if you can. You gotta have a good attitude. You can't focus on your pain. You need to focus on getting better. It's the mindset.
Psychologically, I felt good about that.
We went to mindfulness classes. We did relaxation exercises as well.
We do a lot of things. We'll go to the beach and take a swim, walk on the beach, stay active wherever we are.
That's what we do. We live our life.
We can still do a lot of things that we've enjoyed. And you have a pretty set routine in the morning. I mean, you take your pills, you take the dogs, and then that starts the day to go on and do whatever we want to do.
The routine is an important part. And frankly, the week at a time pill boxes, I think, are critical for us.
Getting out with other people, I think, helps a lot. That's why we enjoy going to the club and playing bridge or that sort of thing. We're fortunate enough to have much of our family near us. So interacting with them keeps us looking forward to the next day.
Important safety information. Before taking Attruby, tell your healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Attruby? The most common side effects of Attruby were mild and include diarrhea, stomach area, abdominal pain. These are not all of the possible side effects of Attruby. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.